It is my honor and delight to introduce Dr. Jasmine Zain from City of Hope. So this is her home turf here, and she was one of the hosts for the World Congress for the last 2.5 days. So it's really amazing that she's joining us here. And I will say, she's gonna share about artificial intelligence, and there was a lot of presentations and discussions over the last couple of days of how can we use this new technology to help us in our world of cutaneous lymphoma. And I was pretty excited about some of the discussions and the topics, but I'm gonna turn it over to Dr. Zain to take it from here.
Well, thank you very much. Thank you. Thank you, Susan, and thank you for inviting me to give this interesting talk. Now, it's pretty simple because I'm not I'm a physician, I'm a clinician. I don't know much about computers, but I think at this day and age, we can't be in this world without knowing something about this and knowing where this is headed. It's both scary, but it's also exciting. So I'm going to try to do my best to give you some basics and answer your questions. So I want to start with just what exactly do we mean by AI? So AI, or artificial intelligence, is the science of creating machines that can think like humans. Now that's very simplistic, and it's kind of like, what do you mean think like humans? Humans are unique. But it's trying to mimic how the human mind works, how we take in information, how we process information, and how we sort of use that to draw conclusions and to draw, do the things we do in our everyday life. A lot goes in. We see things, we hear things, we process it. So basically, the computers are trying to do the same things. And I don't think they want to take over humans, but at least I don't believe that. But that's the kind of technology that's being developed. So I'm going to start with a poem about cutaneous lymphomas. And I'm going to use my glasses to see this. In the realm where cells divide and thrive, there lies a tell of a condition not contrived. Mycosis fungoides, a name it's given, a journey through which many have striven. A melody rare in lymphocytes it resides, on the skin's surface where it often hides. Patches, plaques, and tumors and forms, defying the body's usual norms. In the early stages, it's often mistaken for eczema or psoriasis, its identity forsaken. But as it progresses, its true nature revealed, a cancer of T cells no longer concealed. Though its course is slow and often quite stable, it reminds us of life's nature, ever changeable. Yet, hope persists in treatments diverse, in rays of light and medicines verse. Mycosis fungoides, a challenge indeed, but in science and research, we take heed. For every melody that in nature we find, there's a cure or comfort nor far behind. Written by AI. So I asked ChatGPT to give me a poem about mycosis fungoides, and it came up with a pretty good poem and pictures. Okay? And it went on and on. You could do a poem about the patch stage or plaque stage, but I thought this was pretty cool. So this is ChatGPT on our phones. We can just do this as even as we sit here. But then when I asked it to give me pictures about cutaneous T-cell lymphoma, I got this. And this is one of the better ones. There were weird things that were coming up. So it doesn't always give us the right information. That's the point. It doesn't, we can't say that, everything is AI. We've got to be careful about how we interpret that. Yes?
That unless you're on 4 or higher level, you're 2 years behind.
Exactly. I was going to get to that. Yeah. So the information is also old. So, again, it's going to always be a little bit behind. So we know that that's not what mycosis fungoides looks like. So this is basically some of the technology that is being used in the realm of AI. It's a branch of computer science where we're trying to develop computer systems to make decisions. And the reason there is a humanoid there with all those connections is because that's kind of a depiction of how the brain neurons work. So you basically give information and to the brain or to the computer, and then it basically goes through what's called learning or deep learning. It will form these, it'll take the information, analyze it, and sort of pass it on through different pathways. It can be applied to speech, for example. You can have people's sounds, different sounds go into this machine, and it can then be linked to what the actual, the source of that sound is, and then it can be reproduced. So it can be used for speech. Same thing with vision. Then there is things like, deep learning and language processing, where they can look at different words, pick out words from different documents, and find information that way. There's robotics that's part of this whole AI system. There is, there's processes to optimize this information. So this is sort of like a neural network. So you basically take some information, the computer processes. We've been having computers doing processing all this time. You can add, subtract, write, et cetera. That's processing. And then it just kind of keeps taking that information, looks for patterns in that information, and keeps track of that. One of the advantages of AI is that it can actually process large amounts of data, things that would take humans hours and hours to do, and kind of look for those patterns, and that looks for those algorithms, they're called, in that information, and spit out the result. So that's the advantage of having these large computer systems. Some of the terms that I had to learn to do this talk, one of them is machine learning. Machine learning is basically provides machines or computers with the ability to automatically learn from data, from past experiences, while identifying patterns. So for example, you'll show the computer apples and oranges, and tell the computer apples are red, oranges are orange. Look at this, show pictures of that, keep showing that, and then you give them tests sort of to see if it's learned it enough, or has associated red with apple enough number of times that when you put a red apple, it can pick it out of a basket of oranges, for example. So that's kind of what's called machine learning. And then it can, basically that data can become more and more complicated, and it can be used to make predictions. Hopefully or at least the goal of these processes is that, human intervention is minimal, but obviously we need human oversight. And then there's something called deep learning, where it gets even more complicated. You have these information pathways that are attached to nodes, and then it gets further processed. So it keeps on going into these different algorithms, and it becomes a more complex way of processing information. So that's deep learning. And these are sort of like an algorithm or a picture of what these neural networks look like. They don't look like the human brain, but you have these the information goes in on one end, for example, on these orange blocks, and it gets processed in stepwise manner. And as you can see, these lines intersect, and they start to recognize different patterns. For example, orange will lead to blue, and blue will lead to green, and that is one pattern. And then you can test it, and it can predict things. But next time it sees these orange, blue, or red dots, it can sort of say, okay, this was the information that was processed to this. It remembers that. And it can then predict the next time it sees a pattern, whether it matches that or not. You can test it as true, whether it's true or not. You can pick out all the mistakes. And it continues to learn. If it makes a mistake and you tell it it's made a mistake, it'll go back and learn it. So it learns from itself subsequently. You all know that because when you go to Amazon or something and you buy something, all of a sudden you start getting all these ads for something similar, because the computer has seen that you bought an item X, and that maybe you're in that need, you need this item X, so it keeps suggesting things for you that are based on that algorithm of needing that item X. So it sort of learns by itself, and these algorithms are actually in play in our everyday life already. How AI works, again, I've sort of mentioned that. You input data, and data can be in the form of speech. It can be in the form of, text, images, other things, and then it starts to process the data, interpret it, as I've mentioned, and then you have an outcome, and you can see the arrows going up and down and back and forth, so it learns from each other. And again, on the right side, you can see these components of different components of AI that are being used by computer scientists process this. Now, how does all of this affect patients, and how can we use this in the realm of CTCL is really what we're here for. So one of the things that, I mean, there was a lot of information in this meeting, so I'm not going to be able to show that all today, but hopefully we can actually summarize that in one of our upcoming letters. But basically, one of the uses that is pretty common is what's called digital pathology. So one of the challenges that has been in early cutaneous lymphomas is how do you differentiate them from eczema or psoriasis? And you really need expert eyes for that, and there's only a limited number. So digital pathology is where you can actually take scans of, when we look at pathology, we take a tumor sample or a biopsy sample, and then we make slides of it on a glass slide. The thin tissue is kind of stuck there, and then it's given different stains, and then you look at it under the microscope. But you can take those slides, and instead of just somebody looking at it, you can also scan them into a database. And you can, once you have all these scans, you can actually make 3D images of that whole, so the tissue slice is sort of like a longitudinal piece of tissue. You have a two-dimensional image or a slice, and then you can put them together to see what the whole thing looks like. It's also a tissue bank now. Now it's in the bank. So the next time a pathologist far away has a tissue sample, then they don't have that expertise on hand, they can go to that bank and they can pull that out and see which one, how does that match. So this digital pathology has made the process of trying to read these slides by experts a lot easier because there's all these big data banks, and the computer can also make some predictions based on some of these, this information that's fed into it. So if there's you may not even need an actual pathologist. I think that was some of the things that we learned at the meeting. They had several studies where they were looking at large volumes of these slides between benign and malignant lesions to see what is there that a human eye is missing that can possibly differentiate these, psoriasis from early MF, based on how the computer can utilize that information, because it has the information of thousands of different slides fed into it, whereas we have, whatever the human brain can hold, right? It's our experience from what slides we've seen before, et cetera. So this is useful in places where expertise is not available. Now you can apply that to PET scans and radiology data. You can apply that to photography, skin lesions. And there was a presentation from Australia where they actually had used AI to look at skin lesions from remote areas. People who lived in remote areas, they would send these three-dimensional images of their skin lesions, and the computer can sort through that, and an expert pathologist at the other, an expert dermatologist on the other end can look at those lesions and assess thickness and things like that. So again, a human eye may not be able to judge all that, but when you have all this information fed into it, it adds as a stronger tool. So I think this is all going to be coming more and more, and it is particularly useful in situations where there's an area of grayness and things are not so black and white, and you need expertise or experience in the past to try to decipher that. So that's one thing. So I talked about images, clinical data, radiology data. Now the other thing you can do is you can feed into the computer case studies of hundreds and thousands of patients, right? So I see a lot of cutaneous lymphoma patients, but even on my best day, I can see 20 patients. Maybe in my best year, I'll see 200 patients, 300 patients. But imagine you have a database of thousands of patients and their clinical history, their pathology information, their treatments, and their outcomes fed into this computer. And it has looked at different patterns and seen, if a patient has, say, 5 tumors on their leg, they respond better to targetin plus something else. However, it gets worse. They end up needing a bone marrow transplant. It's just an example. I'm not saying that's the case. But through thousands of patients' data, it has figured that out. It has seen that pattern happen maybe 30, 40 times. So next time I see a patient with 5 lesions on the leg, that computer can assist me in, and it's not just clinical information, there's also molecular data you can feed into it, their biopsy data, their tumor markers. All of that can go in, and it can help me sort of prognosticate based on that information. Okay, this patient may need a little bit more careful observation. Maybe I should be watching them more carefully. Maybe I should be offering them something different so they don't have that outcome. So that's really the biggest advantage that we're going to have of these systems, that we'll have access to this information from multiple experts, for example, and databases. And that information can get more and more detailed. We are into sequencing patients' tumors now quite a bit. A lot of centers are doing that. But the sequencing database at City of Hope, it's too big for me. Even at one site is too big for me to sort of decipher. I really need the help of the computer to try to decipher patterns of mutations that can predict outcomes or can predict which treatments are going to work. So that information that can be fed in as research goes on is going to get more and more complex. It has been used already in classifying different types of cutaneous lymphomas. Again, as I mentioned, pattern recognition is a big strength of these systems. And so you can have patterns that are more consistent with more benign lesions versus more malignant lesions. I think there's a lot of ambiguity between what psoriasis should look like and what early MF should look like. And certainly people are using this to try to see if they can find a real solution to that problem. Biomarkers of progression, again, I've already talked about that. If you have certain patterns that predict worse outcomes, you can follow those. And again, lots of information, including radiology data, can be fed into these computers. Treatment decisions. Ultimately, I think this will help us in deciding treatment options for patients. Currently, we are not using AI to make treatment decisions, so I want you to not get uncomfortable about that a computer is deciding how you get treated. I don't think it'll be a long time before that actually happens. But I think it will help us figure out best treatment options for our patients. So it's not such a trial and error. It may feel like that sometimes. And currently, we are doing research on these kinds of pathways to try to help us. But we also need to make sure that if we are going to go down that route, that it is validated prospectively, that we make sure that there's real information, because as you can see, the computer can spit out something that's completely wrong. So I think that's my last slide. This concerns about AI. So there is also a negative side to AI that I wanted to touch base on. I think these were some of the questions that were also addressed in the newsletter. So one of the things that I worry about is data breaches. We have all this information in computers, and there's hackers everywhere. How is that going to affect AI? I mean, can they feed wrong information into these computer systems? That's certainly an issue, and that's a bigger problem than I can actually address. So we need policy. We need to make sure there's security systems in place. And also all of us need to understand that we are at risk for being hacked. So we have to be very careful about our even using our phones, et cetera. Misuse of information is definitely there. Somebody was telling me that they requested a paper on something, research paper, and the ChatGPT spit out something that never existed. It just made up a paper completely. So a layperson, somebody who doesn't know the field, may think that's gospel truth. We have to constantly update this, as somebody mentioned. If ChatGPT, the old version is 2 years old. And unless we update that information that goes into these systems, it's never going to be current. And of course, there's a lot more to come. So I have just made a very brief attempt to give you an overview of this and my understanding of it, and I'm open to questions if you have any. Oh, thank you.
Well, thank you for a wonderful presentation. I would really like to bring this back to the patient.
Sure.
The question I'm really puzzled about is, my wife has MF, and I'm an ENT surgeon. So I'm at the other side also of the table, and the good side, I always call it. But it is very good to be on the other side once in a while and get spanked by my wife, by the way. So, and what I learned is this: we never ask patients, what do you eat? What are your environmental things? We live in the middle of Amsterdam, so quite healthy, we think. But is it? Now, if you use AI, like Jeff, he's on the bicycle. I mean, we talked about this. We know exercise in head and neck, and particularly in large procedures, is very important to have a fit patient in order to go through a lengthy procedure. It's also nice to be a fit surgeon, by the way. But that's, apart from that, you need, fitness has really probably been a very good contributor to his not having any adverse effects on very difficult treatment. So could AI be the answer to that? A question like, what exercise do you do? Can we do something with AI and big numbers, put that in supercomputers?
Absolutely, and I think that's ongoing. That's a very good question. And that's a very good concern, because what is healthy diet? What is healthy lifestyle? It changes every day, right? I mean, keto, non-keto, low carb, high carb, fat, this fat, that fat. So I think that's a very good way of trying to use this information to really get information from large cohorts of people, and then to try to see these patterns of what really works and what doesn't work. Because these studies that they do, like nutritional studies, are very biased, right? They're small, they're limited to 2 or 3 years, and patients' recall of what they eat or don't eat. So I think these kinds of tools are actually very important for lifestyle and wellness. And I think we had a booth at the conference about wellness AI as well. You're absolutely right. We could definitely use these tools to get that information and have how that impacts different diseases and outcomes. Absolutely. Great point.
Other questions? I know it's the end of the day. Here you go.
I'm just wondering, jumping ahead, is there any issue already in terms of data sharing? The ability for enough of those information that you're going to gather, for example, photo imagery of the slides, make them more useful by having research centers all agree, yes, we'll pool it to a center location or something.
Right, so that's a great point. Data sharing between institutions is legal. It's determined by our legal teams, and certainly to do something like this, again, due to issues of privacy and authenticity as well, if we do share data, institutions have to have an agreement about the sanctity of that data, because it can't be abused and so on, and who owns that data. So we do that in normal research anyways, and so this will certainly be another use of that. It will definitely be in that area as well. Data sharing, absolutely.
More questions? Oh, I'm coming.
So with you guys all meeting at the World Conference and everything, are you meeting with other lymphoma doctors and you guys are accumulating data information? So
yeah, I mean, we're all. I'm a lymphoma doctor. I don't just do CTCL. So yes, I do research in other lymphomas as well, and we are certainly. I mean, these tools are being used all over medicine in all the different fields. They're being used in cardiology and other diseases as well, because the principles are the same, right? It's generating patterns in data essentially. Yeah. So,
yeah. Other questions? I know it's the end of the day and it's been a lot, but.
I know you have online audience as well.
Yes, we do, but Deb, any questions? No questions? Okay, good. Well, thank you.
Oh, thank
Dr.
you.
Zain.
Thank you for being here, and thank you for listening to me.
We have a little
Oh,
thank you
it's for me.
gift.
Thank
Yes,
you.
for you.
Thank you very much.
Thank you so much.
Appreciate it.